Hello everyone, this is David Flores, CEO of Global Trac Solutions Inc., and welcome to this exclusive Psychedelic Spotlight interview where we're joined by the founder and executive chairman of Field Trip, Mr. Ronan Levy. Mr. Levy was kind enough to sit down with me via Zoom earlier today and discuss the fascinating work Field Trip is involved in with psychedelic-assisted psychotherapy and the future of the psychedelic industry. I hope you will enjoy this interview and encourage you to visit Field Trip at www.fieldtriphealth.com. I guess to just jump into this then. So, obviously, like I said, for individuals like myself that have been following the psychedelic space for a while, I'm familiar with Field Trip and the work you guys are doing, in psychedelic-assisted psychotherapy. But I'd love to give you an opportunity, maybe, for those that are being introduced to Field Trip for the first time here today, to provide an overview of the company, who you guys are, and maybe touch on exactly what is psychedelic-assisted psychotherapy.
Sure. So I'll give a little bit of a background of the people behind Field Trip. 4 of the 5 co-founders came out of the Canadian medical cannabis industry. We had started a company called Canadian Cannabis Clinics, which has become the largest network of cannabis specialized medical clinics in Canada. We've helped well over 100,000 people, and there are 30 locations currently across Canada, continuing to operate and help people. And I think all of us got into the cannabis industry pretty open-minded about the therapeutic potential of cannabis, but we were blown away by just how impactful our clinics and cannabis medicine was. We sold part of that company called Cannabis RX to Aurora Cannabis, which has grown to become one of the largest producers of cannabis globally. We worked pretty closely in Aurora for a couple of years before leaving to start what has become Field Trip.
That's great. And I think that the one thing, if there's one thing that really stands out, and encourages me about the work that Field Trip is involved in, is, really during this time where, mental health has really become, such a significant problem, from a society perspective. When you think about the millions of people out there, globally that are suffering on a day-to-day basis from a variety of debilitating mental health issues and diseases and illnesses, from depression to anxiety, PTSD, and the list goes on. And sort of this coming to terms here, an acknowledgement that some of the more, conventional drugs and medicines that have been used for the better part of the last several decades just, aren't cutting it anymore. And especially with their focus really only being on management. And really the take that you guys have here is really looking to develop actual treatments by identifying the underlying causes and issues associated with many of these illnesses and diseases. And I find that quite profound. So I'd love to kind of, have you touch a little bit more on that and sort of what, the guiding principles are behind the work and everything that you guys are involved in.
Yeah, absolutely. So, based in part on my own experience, having done a lot of work with meditation and therapy and coaching, we've become highly cognizant of the fact that when it comes to most mental health issues that exist these days, depression, anxiety, PTSD, there's almost always an emotional driver, an underlying, complexity that lives outside of just the sort of neurochemical biology that most medicine approaches these conditions with. So with antidepressants, you're not really attempting to address the driver of the depression. You're usually just trying to help people manage the symptomology around it. What's so exciting about psychedelics is they have the capacity, and by their very nature, they force people to confront and ideally, but not always, help people work through or at least identify the drivers of what may be underlying depression and anxiety. Now, certainly depression and anxiety do have biochemical basis for what's happening in the body, but the reason that biochemical reaction is happening is often driven in unprocessed emotions. Again, not always, but for a lot of people, digging into those underlying drivers is essential to changing the mindset, to changing the drivers that create the biochemical causes of depression and anxiety. And so that's exactly what we're leaning into with Field Trip. We lean into the psychedelic aspect. We want people to have the psychedelic experience. There are a number of companies out there, for better or for worse, attempting to remove the psychedelic experience from psychedelic molecules and considering them much more like conventional drugs or pharmacology, which is it's the drug that does the work. But when it comes to how Field Trip approaches mental health challenges, we think the drug is just a catalyst. It's just an opportunity to make the effects of psychotherapy much more effective. And so with our clinics that are rolling out right now, we have three just about open. Toronto and New York are open and seeing patients right now. LA will be opening later this week or early next week. What we're doing is working with ketamine, which is a dissociative psychedelic, as a starting point, and we use it in the context of psychedelic-assisted psychotherapy. So the ketamine is provided. People typically have a trip for about 45 minutes to an hour on the ketamine. It can be, not always, but tends to be a very visual experience. And it helps people just gain perspective and awareness, and shows them insights or realizations that they may not have had about who they are, or where they come from, or what motivates them. And as soon as they come out of the ketamine trip, a psychotherapist is there that does what we call exploratory therapy. So basically helping them identify and verbalize the experience that they just had, help them, recognize what emotions came up, what experiences from their past came up, and documenting them so people can start to think about them and process the underlying and surrounding emotions around them. And that's our protocol. And, it's very consistent with most conventionally conceived of psychedelic protocols, but it hasn't very much been done in conjunction with ketamine. Certainly, as a company, we're excited by the prospect of working with other classic psychedelics like psilocybin or MDMA or anything else that may seek or gain legal approval. But we're starting with ketamine because we think it has a profound opportunity to create real impact by helping people process their emotions. Ketamine is also, the way psychedelics work, or at least the reason that psychedelics seem to show so much promise for treatments for these mental health conditions is twofold. One is with ketamine and psilocybin and MDMA, they are natural antidepressants. So as soon as you take them, most people experience a lift in mood. So it's a positive impact, and in that sense, they're kind of like more conventional antidepressants. But what's really exciting about with psychedelics is that for a period after the trip experience, call it 1 to 2 weeks, there's a period of neuroplasticity during which there's a great opportunity to help people make new connections, literally physical new neural connections in the brain that can help change the patterns and habits that probably led to the depression and anxiety or PTSD, whatever other mental health condition you want to kind of mention in that group. And that's how it works. And so if you're doing, there are a number of clinics currently that are just providing ketamine as an antidepressant. But if you're doing that, you're kind of leaving out the great opportunity to leverage that period post-trip to really ingrain habit change, to really ingrain outlook change, to really ingrain attitude change, which we think is what's going to lead to ultimately much better results for anybody undergoing these treatments, because they're actually doing the work in conjunction with having the benefit of the drug and not just leaving it to the drug itself. So I know I touched on a number of different points there, but that's kind of what we're doing with Field Trip is we're leaning into the psychedelic experience. We're leaning into it as therapy and not medicine, and that the drug is really just there to enhance the efficacy of the therapy.
Right, which is incredibly fascinating, and certainly, the potential here, that we see. It's so much more than just giving, an individual, a patient, just a pill and saying, here, take this every day, and let's hope that it controls or, helps to manage your depression or your anxiety. And I think really, with what you guys are involved in here with, a psychedelic-assisted psychotherapy, it's really going way above and beyond what just a pill can do. And I think that's really where the potential exists here. I know when I talk to people about the potential that psychedelics have to completely revolutionize and completely change psychotherapy, this is why, because there's so much more involved in it than just the psychedelic aspect of it. I mean, this is an entire therapeutic program. I mean, is that a good way to kind of put it?
Yeah, absolutely. So, when people come to our clinics, we, in Toronto, for regulatory reasons, but elsewhere, we encourage people to go through the full course of treatment, because after a single session with ketamine and exploratory therapy, you may start to feel better and you may start to work through stuff. But I like to kind of describe our work as kind of being like the Home Depot for personal awareness or consciousness awareness, which is like, you can do it and we can help, but you got to do the work, right? You have to go into it. Just because a single session may give you insights and awareness, it doesn't mean the process is complete. The truth is our entire life is a learning and growing process that's always going to have different emotions, different considerations, different things that need to be processed. And so we really think of our treatment as a course of treatment, which is we want to go through the whole thing. Typically we see the best results after people go through about 4, 5, or 6 ketamine-assisted psychotherapy sessions. And that's the way we conceive of it. So it's, there's certainly an opportunity, and we have no oppositions per se to having people use it ad hoc, come in for ketamine-assisted psychotherapy or other psychedelic-assisted psychotherapy on a more ad hoc basis. But right now we're really focused on developing a program, develop the best results to show real data and evidence that this is a very effective, very reliable treatment and a very safe treatment as well. And so, yeah, we absolutely think of it as a program, as a course of treatment.
Yeah, no, that's great. I mean, it's so much more than just dealing with, what we see on the surface, and it's really going below the surface and really identifying the root causes of these issues and these diseases. And I think that's, again, where psychedelics really have the potential to go well above and beyond what we've seen with some of the more conventional drugs and medicines that have been used, for the better part of the last several decades. So I appreciate that. Maybe just to pivot slightly and talk a little bit of just a little industry perspective here. I know you coming from the cannabis space, it's also my background, and having been a part of, witnessing the boom and the expansion of that industry. I know myself as a CEO here, in the psychedelic space, if there's one question that I get asked frequently is, are psychedelics cannabis 2.0? And I know a lot of people have their own sort of opinion on that, but I'd like to kind of get your take on it and sort of where you see the industry itself evolving and growing, and maybe some direct comparisons to cannabis and how they're maybe similar, but also different in some ways.
Sure. I mean, the most natural comparators between cannabis and psychedelics is that, not all psychedelics, but many of the psychedelics that we talk about are plant-based psychedelics or fungi-based psychedelics or natural products. I guess is probably the most accurate way to think about it, much like cannabis. And I think people, for a variety of reasons in our modern world, are very attracted to more natural alternatives for health treatments or mental health treatments. And so there's obvious parallels between psychedelics and cannabis in that respect. And there's obvious parallels in the fact that these were both once heavily stigmatized medicines, criminalized mostly for political reasons, not necessarily scientific or health-driven reasons. And so they both kind of sit in that camp. The other big parallel is that, from an industry perspective, is that with the emergence of the evidence being so persuasive for cannabis medicine as well as psychedelic medicine, coming around and being further developed, what we're seeing now is that both industries, it's more established right now with cannabis because it's been more active over the last 10 years, require a whole new set of infrastructure to really support them, a new set of clinical infrastructure, a new supply chain, a new set of people actively working to develop the molecules as well as the therapies around the treatments themselves. So there are parallels in those respects, but I think those parallels are relatively superficial in most considerations. And when you get into the deeper aspects of cannabis medicine versus psychedelic medicine, that's where you think you start to see a lot of the differences, which is cannabis by and large, not entirely, but by and large, works very similar in many ways to antidepressants, which is they help people manage the symptomology associated with a vast number of conditions. And there certainly can be some therapeutic and health benefits from different cannabinoids as well. But typically they're not curing the underlying ailments. They're just making them more manageable. With psychedelics, as we've talked about, psychedelics really help people get to the root cause of many mental health issues and help to process them. And so that's where I think the fundamental difference between cannabis and psychedelics lies. Also, and relatedly, because of that, cannabis is much more of a product, which is something you buy and you take home and you use as needed if you're using it in a therapeutic context. Whereas psychedelics, I think in the industry is going to evolve more and more, are going to be provided as a service because, as we've touched on, psychedelics, the drug themselves are not the end product. The end product is the processing. It's the work being done. Psychedelics just make it a lot easier. They're kind of like motor oil for a car engine.
Mm-hmm.
You know, without having a car engine to apply the motor oil to, there's utility in motor oil, I suppose, but not a whole lot. And the same goes with psychedelics from a therapeutic perspective, which is if you're not doing the work, if you're not doing it in the proper context, the drug themselves is not necessarily a solution from a therapeutic perspective. And so I think the psychedelic industry is going to emerge much more as a service-based industry with treatments and therapeutics and care and tools than a product-based industry, which is like the cannabis industry has emerged as, which is you go buy a product, whether that's, bud, whether that's extracts, whether that's edibles, and you just take it. And that's kind of the end of the road for a cannabis therapeutic experience. So I think that's the fundamental difference between the two is that very different mechanisms of action. And as a result, it's a very different evolution of the industry I expect we'll find.
Yeah, absolutely. I mean, I think this is, most definitely fantastic. And I think one last thing that I would want to touch on, I don't want to take up too much of your time, so we'll get ready to wrap things up. But I just want to touch on, I know there was some pretty big news that came out recently with the release of the app, the Field Trip app that you guys just put out. And so I'd love to kind of hear a little bit more about the app and sort of how it ties into, the therapeutic programs that you guys offer, through your clinics and everything that is going on. And I mean, does it offer sort of a peek into the future of where things are going here with Field Trip?
So the impetus for the app really came out of the fact that late last year we were doing a strategy session, and we realized that with the decriminalization efforts happening and succeeding across the U.S. and with psychedelics going much more mainstream, there are going to be a lot of people who are actively working with psychedelics, legal or otherwise, or psychedelic experiences, I should say more transparently, legal or otherwise, that don't necessarily have the support. And we looked and we realized that in our clinics, we're building what we consider the best-in-class tools and protocols and therapies to support people through psychedelic-assisted psychotherapy. And that through a digital tool like an app, we could take a lot of those, synthesize that into something that's very simple and digestible for the average person that doesn't have the benefit of a therapist or a clinic available to them, and make sure that on a harm reduction basis, that if they are going to engage in working with psychedelic experiences, for whatever reason, they're being guided and have the best protocols to leverage as they go through it. Because, I think as Rick Doblin has said, the most important thing that anybody in the psychedelic industry can do right now is make sure we don't fuck it up. And to make sure we don't fuck it up, one of the best things you can do is recognize that it'd be naive to think that people aren't going to be doing this on their own or aren't doing this on their own presently.
Right.
So let's get out there and let's make sure that if they're doing it with the best, in the best way possible to ensure the maximum likelihood of a positive experience and minimize the likelihood of a negative experience. And I think it also reflects just kind of broader philosophy that we have at Field Trip. Certainly we are a medical first organization because that's where the immediate opportunity is. And I think we need to establish the efficacy and safety profiles for all these therapies before, we can or should be taking them out into broader use context. That being said, I think it would probably be a failure of the renaissance of psychedelics if the use of psychedelics was restricted to only people who have clinical diagnoses of mental health conditions. Because you don't have to have depression or anxiety or PTSD to potentially benefit from psychedelic therapies. Just like you don't have to be depressed or anxious to benefit from cognitive behavioral therapy. There's a lot of advantages and benefits for everybody to be doing this kind of work, thinking of mental health and mental well-being, much like we think about physical fitness, which is we all recognize, even though not all of us are good at keeping up with the habit, but we all recognize that going to the gym and staying physically active makes us healthier, makes us happier, leads to longer lives. And I think the exact same thing is true for mental health. And we think, and I personally believe that psychedelics are going to be the platform that really drives that conversation about mental health being a proactive pursuit, much like physical fitness. And in that regard, the Trip app, which again is certainly not designed to encourage any illicit behavior, we explicitly discourage people from engaging in any illicit drug use or anything along those lines. But we do actively encourage people to engage in legal or permitted forms of consciousness expansion, whether that's meditation or breath work or anything that's along those lines that's legal and permitted, because there's a lot of benefit from it. And so the app is also, on a harm reduction basis out there to help people make sure if they're doing things, they're doing it in the right way, but also for people doing things that are permitted, that are okay, that they're also leveraging the best tools, because meditation is great. Mindfulness is fantastic. But again, it's only a starting point, right? Becoming aware of your emotions, I think, is fundamentally important for anyone's evolution emotionally or spiritually. But if you really want to see meaningful change in your attitude and outlook, you not only have to become aware of your emotions, you have to start learning how to process your emotions properly, process anger, process hurt, process shame, also process happiness and joy and all of these kind of things. And so a lot of that emotional processing, in whatever form people are tapping into it, the therapies and protocols that we've developed are really designed to help people do that. And so giving those tools out, making them available on a much broader basis through the app really speaks to the kind of broader consideration and potential of the psychedelics, which is not just for sick people, that they can profoundly and significantly improve the quality of life of quote unquote healthy normals. And the app is really designed to be a platform to start driving that forward.
Yeah, which is incredibly exciting. I know I was having a conversation a couple of weeks ago and talking about sort of the different directions that I feel like psychedelics as an industry, has the opportunity to go in as it continues to evolve. And one area I was touching on was self-help, in integrating psychedelics into a variety of different treatments and programs designed to enhance cognitive capabilities, whether it's, performance in an individual's professional life or in their personal life, helping to become a better husband or wife or a better parent. I think there's so much diversity here with the potential of psychedelics, and seeing you guys sort of understanding that and recognizing where the potential exists and the direction that things are moving in, and really laying the foundation right now, is really impressive. And I got to commend, the work that you guys are doing, and it's fantastic. It's exciting, and I'm really happy to be able to share, your story here with our viewers and with our audience here, and looking forward to hoping to follow up and continue, monitoring the progress here that you guys are making. I know there's a lot of things that are still ahead here in the future for you guys, right?
Yeah, absolutely. I like to kind of describe that when it comes to the psychedelic industry, the game hasn't even started. We're still in the pregame warm-up. So there's an incredible amount of opportunity. There's an incredible amount of work to do, and there's an incredible amount of impact to create. I really think that we have the foundation in the psychedelics industry to profoundly and positively improve the lives of millions, if not billions, of people. So it's an exciting place to be. It's great to see organizations like yours coming out to help, spread the word and create awareness, drive the conversation forward, because that's certainly what we're trying to do as well. And the more people talking about it, the more people focused on being objective and providing real information, and helping to open people's eyes to the potential here is, I think it's laudable. I think it's important, and it's great to be a part of it.
Yeah, absolutely. So again, thank you again for taking time, Ronan, to speak with me here. We'll get the website information for Field Trip added to this audio clip and share it, so anybody that's interested in looking at Field Trip a little bit more and seeing the progress of the company, they'll be able to go take a look at it. But again, thank you so much. I appreciate it.